Okay, welcome back. In this lecture, we'll be talking about the endocrine pancreas. So this is not the last time you will hear about the pancreas, right? We're going to talk about that as a digestive organ, and that's actually the majority of what it does. 99% of what the pancreas does is actually produce digestive enzymes. And so on here, you'll see this nice duct running down the center of the pancreas and sending those products into the pancreas. That is an exocrine product, right? It's going through a duct and it's going into the surface. What we're looking at today is the 1% of the pancreas, right, in what are called the Islets of Langerhans, right? And this is the endocrine component of the pancreas, and it actually produces a few different hormones, right? And we're not going to get into all of them, but we will talk a little bit about the fact that in these islets, we have alpha cells that produce glucagon, and we have beta cells that produce insulin. And a lot of times people forget about glucagon, and it's super important, and it sounds so much like glycogen and glucose that people get really confused. So we're going to make sure we get this straight here. And so, as we're looking at these hormones, again, the thing to keep in mind here is that glucagon is basically acting to increase glucose in the blood. It's terrible, right? To increase glucose in the blood. Insulin, which we're more familiar with talking about, is actually, right, it's increasing the uptake and use of glucose, which means that it's decreasing blood glucose levels. Okay? So, insulin and glucagon end up talking to a lot of different cells in the body. Not every cell needs to use glucose to let insulin in, but quite a few of them do. So this is kind of what it looks like, right? We're trying to maintain homeostasis of these blood glucose levels. And so we're just going to follow this figure 1819 here, and we see the fact that blood glucose levels are increasing. And so you might stop and think, well, what's increasing blood glucose levels? Okay, you just had a snack. You had an ice cream cone or a hamburger or something like that, right? And so that is going to act as a stimulus to tell, the pancreas to secrete insulin, right? And also, it's going to tell things like different digestive organs, and also the autonomic nervous system can trigger that insulin and release as well. But primarily, we're thinking about the pancreas releasing this insulin, and then most tissues, so they picked skeletal muscle and the liver here, to use that glucose. Now, the liver is a really important choice. Sorry. Now the liver looks like a smiley face. Okay, so the liver is actually a super important choice here because any excess glucose, the liver can convert that into adipose, into fat for storage later. Okay, so by taking that glucose into the cells, in some of these tissues, we bring blood glucose levels down to normal. Now, if the opposite happens, right? If blood glucose levels drop, you wake up in the morning, you skip breakfast, you're running late to class, whatever, what we're going to see is that no insulin is released, okay? And instead, what we're going to see is the liver being able to release glucose that it has stored in the form of glycogen. I really wish in this chart they would have put glucagon, right? Because that hormone, what you should see is that when homeostasis is disturbed in this upward direction, right, what we have up here is insulin release, right? But when those blood glucose levels drop, it's going to be glucagon that's being released to tell the liver to actually split the glycogen into glucose and put that back into the blood, right, to get us back to homeostasis. Okay, so last thing I want to say about the pancreas and insulin is it's really famous, probably primarily due to a disease called diabetes mellitus. And you guys are, hopefully, if you're interested in the healthcare field, you've already been thinking some about type 1 diabetes and type 2 diabetes. Now, this image is really trying to emphasize what I would say some of the factors that can lead to type 2 diabetes. So type 2 diabetes is considered a more, things like obesity contribute to it, sedentary lifestyle, some things with diet. But I will also tell you this, there's actually a much stronger genetic correlation with type 2 diabetes. It runs in families. So there's a little bit of something else going on there that maybe we don't understand. Type 2 diabetes used to be considered adult onset. People were getting that later in life when they started to let themselves go. We're seeing this happen in children. Now, type 1 diabetes, the main cause of that is actually an autoimmune disorder where the patient's body actually attacks the beta cells in the pancreas that should be producing the insulin, kills those off, and the patient is no longer able to produce their own insulin. Someone with type 1 diabetes absolutely has to use insulin injections to control their blood glucose levels. Someone with type 2 diabetes, keep in mind, the way at least it usually starts is that you get this insulin insensitivity. There's some sort of like down regulation. Cells stop listening to insulin, and so blood glucose levels stay high, stay high, stay high. They're never getting drawn down into the cells. Now, eventually that can actually burn out the cells in the pancreas, and we'll see a type 2 diabetic who actually need to replace insulin as well. You'll get to talk about that more. I hear that it's like all topic in nursing school, and we definitely talk about it. So, alrighty, you guys have a great one.